Hello and welcome back to GP Video Podcast by Nadia, and we are still talking about fatigue or tiredness or lethargy. So, as I have said again and again, that we have got four main classes of causes for fatigue, and usually there are different causes from different classes present at the end or at the bottom of a person who's present at the bottom of a person's condition. When a patient presents to fatigue, it's actually when he cannot deal with it and it's been ongoing and chronic for a long time. And usually that kind of chronic fatigue is usually caused by a combination of lifestyle factors, mental health factors, physical health factors, and work-related stress. So we said that these are the four broad categories. But I would like to also tell you again that fatigue, as I said, is a symptom complex. It is both mental and physical. Usually it's both mental and physical, and the factors are also both mental and physical. So in therapeutic guidelines, it's written that fatigue is a feature of many conditions and presentations in primary care. A definitive diagnosis can be made in a half to two-thirds of patients who present with fatigue in general practice. So actually taking a nice detailed history, examination and investigations can lead to a reason in a half to two-thirds of the patients who present to the practice with chronic lethargy, fatigue, tiredness, lack of energy, whatever you want to term it. So they also say that fatigue is frequently associated with psychosocial or environmental factors, example, occupational or financial stress, family conflict. The demands of a busy life can lead to fatigue at any age, from parents who juggle various roles to children with multiple extracurricular activities. People may have unreasonable expectations of what can fit into their day, and fatigue may be a normal response. So just because you cannot do everything in the 24 hours, that makes you mentally and physically fatigued. Again, too much physical exertion or too much mental exertion or lack of physical activity and depression, anxiety, they can all lead to both mental and physical. Mental reasons can lead to physical fatigue. Physical reasons can lead to mental fatigue, and vice versa. So it's all very, very, very interconnected, interrelated, and very complicated. Presentation with fatigue may also be a plea for help or a consequence of bereavement. Behavioral factors such as excessive alcohol intake, substance use, lack of exercise or too much physical exertion, and poor diet, and then lack of sleep or too much sleep can all lead to fatigue. Caffeine can also lead to lack of sleep, and that can again. So every cause has got different causes at the bottom. So it's all very, very, very complicated and interrelated. So a thorough history is very, very, very important. So in mental health causes, we said that anxiety, depression, PTSD, mental conflict, stress, everything can lead to mental and both physical and mental fatigue. But the most important condition that GPs really want to work on is the medical causes. What are the medical causes? And we shouldn't be missing any sinistrous cause or anything that we could have diagnosed and we didn't, and we could have treated but we couldn't. Chronic fatigue syndrome, I'm again telling you, is another condition that we'll talk about some other time, but this is about the general causes of fatigue. So when we started the medical conditions in the previous podcast, we said that number one is cancers or malignant conditions. Anywhere in the body, any malignancy can cause fatigue. Number two, we said anemia, because of any reason can present with fatigue. Number three, we said nutritional deficiencies, and especially I spoke about iron, vitamin D, and vitamin B12 deficiency. These three can lead to lack of energy and fatigue. Then we have number four category that I didn't speak about in the last podcast is sleep-related disorders, including obstructive sleep apnea in adults, sleep disordered breathing in children, insomnia in adults, sleep problems in children and adolescents, advanced sleep-wake phase disorder, and delayed sleep-wake phase disorder. So these are any sleep-related disorder which